Hello everyone, in this video, we're going to talk about diabetic ketoacidosis. Essentials of diagnosis: hyperglycemia more than 250 milligrams per deciliter, metabolic acidosis with blood, pH 7.3, serum bicarbonate 15 milliequivalents per liter, serum positive for ketones. Diabetic ketoacidosis is a disorder primarily in patients with type 1 diabetes, but can occur in patients with type 2 diabetes who have severe illness, such as sepsis or trauma. It is a life-threatening medical emergency. Symptoms and signs. Appearance of DKA is usually preceded by a day or more of polyuria and polydipsia. Marked fatigue, nausea, and vomiting. Dehydration with rapid deep breathing and a fruity breath odor of acetone strongly suggests the diagnosis. Hypotension with tachycardia indicates profound fluid and electrolyte depletion. Mild hypothermia is usually present. Abdominal pain. Tenderness may be present in the absence of abdominal disease.